Okay, so your philosophy then as a dentist, biomimetic dentist, got that right?
Yes.
Is to not destroy or carve down the whole tooth and put a crown on it. Is to just cover the diseased part? Is that right?
That's correct. That's correct.
And in that way you keep the flex, tooth lasts longer, less decay. It's just a better way.
Not only that, Randy, but we have techniques and chemicals where we remove the decay down to a certain level, then we put a certain chemical in there to tell us how much bacterial growth there is remaining in the tooth. And we can stop removing the decay at a certain point and avoid most root canals even.
Okay.
Because when you take the nerve out of the tooth, you destroy that lymphatic system, and the tooth over time becomes a piece of petrified wood.
Is there science behind this? I mean,
absolutely.
So what's the number one reason, though, that a crown fails if you have to do it every 9 years or so?
Recurrent decay around the margins.
Around the bottom of the tooth.
And the margins tend to open up with time because of the food we chew. That flex is gone in the tooth, and so it's transferred down to the gum line, and that's where the margins start to open up. And over time, we can stick our Dental Explorer underneath the margins and find soft tooth structures, so we have to replace the crown.
So what do you do? Okay, so somebody has been told, you got to get a crown. Do you ask for a skull cap crown? Do you ask for a biomimetic dentist? I mean, what do you do?
Well, if somebody needs a crown, they need to at least get the opinion of a biomimetic dentist so they can be more conservative. Because crowns are still the mainstay in dentistry. That's what most dentists still do. They do crowns.
Okay.
It's easier and less
Is it true you
time-consuming.
could make more money? I spoke to your associate. He says, you know, he could make a lot more money doing crowns all day.
Absolutely.
But he likes to do it this way, which the other way takes 10 minutes. This way takes about an hour and a half.
I have what they call RDAEF assistants, 2 of them. Registered Dental Assistant Expanded Function.
Okay.
So I go in and I can prep this crown in 7 minutes, and I can walk out of the room and they take the impression legally, they put the temporary crown on there legally, and the patient comes back in 2 weeks and I take another 5 minutes to cement the crown.
And that's how it's normally done?
That's 10-15 minutes of my time.
So if you did that all day, you'd make more money. Well, why do it this way then?
Well, it takes me an hour and 15 minutes of my time to make this type of skull cap.
Okay.
But it's a holistic way of restoring the mouth. It's the healthier way.
It's a healthier way.
It preserves tooth structure so that as the patient is chewing, they have that shock absorber functioning more like nature intended it.
Let's take a quick break. When you have a model,
yes.
So we'll talk about the model when we get back.
Gotcha.
Now, if you've been told you need a crown, you've got to hear this next segment. We'll be right back.